Good afternoon, everybody. Welcome to the Congressional District Health Dashboard webinar. We're going to give folks a little bit of time to join us, and really happy to have you. And as folks join, please keep an eye out for a poll, which will be appearing on the screen soon. And again, we'll just give people a little bit of time to join us this afternoon. Stay tuned. Hi, everybody. We're still waiting for folks to join. This is Gary Thermalia from the Robert Wood Johnson Foundation. And we want to just give folks another 30 seconds to join us. We know we have close to 1,000 people that have RSVP'd for this session. So we'll give them a chance to join us. And as noted in the chat, very soon we're going to be adding a poll that everybody can respond to just give us a sense of what sector they're from. All right, and there is the poll. It's appearing on my screen. I assume it's appearing on others as well. Please take a moment to respond to that poll so we can get a sense of who is joining us today. All right, we'll leave this open for maybe another 20 seconds and then see what the results look like. All right, maybe we can take a look at the poll results and get the webinar officially started. So I'm hoping folks can see the results of this poll. Seems like we have a really great mix of people from both inside and outside of government, from advocacy, research, and other sectors. And I think this spectrum of folks that are on the webinar today are really among the key audiences for the Congressional District Health Dashboard. So very glad to have you. We're going to kick things off now. And I will introduce myself again. I'm Gary Thermalia, Senior Program Policy Officer at the Robert Wood Johnson Foundation. And we are just so excited to have all of you here today for the launch of the Congressional District Health Dashboard. We really believe it's an amazing tool that will transform the way in which you all do your work every day. The Robert Wood Johnson Foundation is committed to improving health and health equity in this country, and in partnership with others like NYU Langone Health, we are working to develop a culture of health so everyone can thrive, no matter who they are, where they live, or how much money they have. Here is an overview of the webinar for this afternoon. We're going to be introducing the Congressional District Health Dashboard to you, talking with health policy experts on how this dashboard can drive changes in policy, and then hearing from you about your questions and reflections on the dashboard. Next slide, please. We really do have an amazing group of folks who will be educating and engaging with us today at the intersections of data, policy, and social change. I'm happy to introduce them. First is Dr. Mark Gurevich, Primary Investigator for the Congressional District Health Dashboard at NYU Langone Health. With us today is also Andrew Hu, Director for Bipartisan Policy Center Action, and Carolyn Mullen, Senior Vice President of Government Affairs and Public Relations at the Association of State and Territorial Health Officials. Next slide, please. So a few housekeeping items before we start. First is that this webinar is being recorded and will be shared with all participants via email after the session is over. Second, if you're having any technical difficulties, such as no audio or anything else, please use the raise your hand feature and we'll send you a chat and try to fix that for you. We encourage you to share your questions and comments through the chat function. All participants will be muted. Next slide, please. So as we get into the meat of the conversation today, we just wanted to start with a brief note on the power of data. I think all of us can appreciate that data by itself can't change policy, but it's a very, very important ingredient. Data can do several things. It can reveal challenges in assets and communities that may otherwise have been hidden. Data can inform effective policy solutions and point us towards what might work in one community, even if it might not work in another. And then lastly, data can be used to hold leaders accountable. It can help us answer the question of whether leaders are living up to their commitments and responsibilities. So in these ways and more, we want all of you to think about how the Congressional District Health Dashboard can reveal, inform, and hold leaders accountable. And we're really, really looking forward to hearing from you today and afterwards on how to use this tool and how to improve it over time. So to move us into a presentation about the dashboard itself, I'm going to turn it over to Mark Gurevich. Mark? You're on mute, Mark.
Okay.
Got it.
There you go. Thank you. It's great to be with you all this afternoon. And
Mark, it looks like you're muted again, and we've lost you on camera. Okay, there you are.
How's that? Can you hear me all right?
We can see and we can hear you. Yep.
Terrific. Thank you. Sorry for that. It's really wonderful to be here with everyone this afternoon. And thank you, Girther. We're honored to partner with you and with the Robert Wood Johnson Foundation on this new tool for supporting health-related change-making really across the country. So let me begin by framing, why we created the Congressional District Health Dashboard and what it is. The challenge we set out to address was really the absence at the congressional district level of rigorous, district-specific, nonpartisan data for policymakers on health and the conditions that affect health. And certainly the COVID pandemic further underscored the importance of reliable data on health and the conditions that shape it. And so our goal in this is really to provide granular health-related data at the congressional district level that's straightforward and unbiased to help inform and catalyze priority setting. The audiences we have in mind are really all of you, as you indicated, elected officials and their staff, advocates, people in public service really across the country, journalists and media, researchers, and really anyone who wants to know more about health in their district. In this effort, we've also built on our team's experience developing and leading the City Health Dashboard, which is a separate tool that helps cities and towns across the country leverage the power of data to improve health. So in creating the Congressional District Health Dashboard, we partnered with, in addition to the Robert Wood Johnson Foundation, colleagues at the Bipartisan Policy Center and the Center on Budget and Policy Priorities. So really also happy to send them a strong shout out today for their partnership. And we're pleased to be launching the site with you today and thereby really making accessible in one place data on health and the social, economic, and environmental conditions that affect it in congressional districts across the country. Okay, so Here now, turning to the slides, you'll see the 36 metrics on the dashboard about which you will find data at the congressional district level on this new tool. As you can see from looking at this list, we aim for a broad view of health and the conditions that contribute to it. And the measures that are on the dashboard really then fall into these 5 broad categories that you see. One is actual measures of health, like deaths from cardiovascular disease. 2, social and economic drivers of health, like high school graduation, rent burden, broadband access. 3, behaviors that influence health, let's say physical inactivity or smoking rates. 4, environmental factors like air pollution and lead risk. And finally, access to healthcare services. There are also demographic breakdowns for selected metrics, and I'll give more detail on that in a moment. Importantly, to be included on the dashboard, a metric has to meet a couple of important criteria. It must be rigorously derived, actionable, possible to update regularly, available nationally, and have an evidence base regarding its impact on health. The data sources that we draw upon for these 36 measures include the CDC, the Census's American Community Survey, the EPA, Environmental Protection Agency, and others. And what did we actually do with the data from these sources to generate the data on the dashboard? At a very general level, and there are a lot of advanced analytics behind this part, we took health and related data that were originally obtained at the county or neighborhood level, and we decomposed it into very small building blocks. You can think of them as the smallest geographic jigsaw pieces possible. And then we reassembled these pieces, accounting for population distributions, to fit the exact boundaries of the newly redrawn, in 2022 that is, the newly redrawn congressional districts for the 118th Congress. In that way, we developed and have really now extensively validated the data on the site that we're going to share with you today. We're also committed to providing the most recent data available, and we'll be updating the dashboard as the underlying data sources themselves are refreshed, typically yearly. And we plan on adding new metrics in the future, reflecting evolving national priorities, user needs, and our own research. All right, so now is a very exciting moment. Let's tour the site and acquaint you with its data and its main features. My colleague, Becky Ofron, will help us navigate through the site today. So we begin our journey by typing in congressionaldistricthealthdashboard.org. We know that that is a bit of a mouthful, but you only have to type it in once before you bookmark it forever. On the home page, you can use the top menu as a guide, or start with a snapshot here in the center. Let's begin by typing a specific congressional district or your state to select a district within the state. In this case, let's use New York's 7th. Once selected, you'll be brought to the snapshot view, a hallmark of the site. Starting on the Metrics Overview tab, you can dive right into a high-level overview of the district's status on the full range of metrics. These are all the same metrics that you saw listed by their 5 categories on the earlier slide, just that now you're seeing them here listed in alphabetical order. As you browse the list, you'll see the value for each metric specific to the congressional district that you've selected, as well as how that district's values compare to the national average. The tooltip next to each metric shows the data source and year. If you click more about this metric, which we're not going to do right now, you will be brought to additional information. Some metrics also have demographic breakdowns, and you can access that important information here as well. And what if you want to know some basic facts about a district, like its demographic makeup or its representation in Congress? Well, here at the top, you can select the District Facts tab This shows population facts like age and racial ethnic distribution, plus at the bottom, the district's representation. We learned that this district, New York 7th, as mentioned before, is a little over 1/3 white, with a similar proportion of Hispanic residents and about 13% Asian, about 10% Black. And from the district snapshot, you can easily change to viewing another district here. All right, so now let's explore some maps. Let's begin with the national level map view of a metric. So you start from the top menu, metric maps. Here, you can select any of the dashboard's metrics across the 5 categories that we reviewed before. Specifically, let's look this time at rent burden, the percentage of a district's households that are spending more than 30% of their income on rent. Being rent burdened puts people at risk for poorer health, including mental health. Here, the site displays a national view of rent burden by congressional district. At a glance, you can see that rent burden varies by district across the country. Deeper shades represent poorer outcomes, and lighter shades represent better outcomes, here and throughout the site. The statement and scale bar at the top show here that the average proportion of households facing significant rent burden in 2020 was about 47%. The scale bar minimum and maximum values reflect the full range of values across all congressional districts. In this case, from a low of 34% in one district to a high of 66% in another. So let's say you're working for a senator and interested in exploring congressional districts within a state. Let's head to California. You can zoom in on the map or type California in the selector. Here, we see substantial variation among the 52 congressional districts in California. We can select a district to home in on. Let's say California is 29th. It has an average rent burden of 64%. When viewing a district on the map, you can switch right here from comparing it against the US-wide average to comparing it instead against the statewide average of the state that it's in. In this case, the countrywide average is 47% of the population experiencing rent burden, and the California average is 53%. Okay, so now that you've seen the site's basic setup, let's demo a little more fully how to explore race, ethnicity, and other demographics. We're going to return now to the full national map, but this time using the backtrack links at the top, and select another metric, the percentage of the district population that is uninsured. The map shows some higher rates of uninsured population here in Texas, so let's zoom in to take a closer look. By clicking on districts of interest, we see that Texas's 15th district has one of the highest rates of uninsured residents. So let's select Texas 15 and go to the district map itself. Say you're interested in how uninsurance varies by race ethnicity in this district. You can scroll to these tiles underneath the map. In this case, we'll pick this one to view the demographic detail for this metric. Now you can see the available demographic breakdowns for uninsurance in Texas 15, including sex, race, ethnicity, and age. We see that uninsurance is highest among 19 to 25-year-olds in the district, as well as among the district's Hispanic residents. You might be asking, why is there no data available here for Black residents? The reason is that while we aim to present as much demographic data as possible, for some of the dashboard's metrics, the racial ethnic subgroup numbers involved are at times too small to yield reliable estimates. In Texas 15, in this example, Black residents comprise only 1% of that district's population. So the numbers simply become too sparse to reliably estimate the number of Black uninsured persons in this district. Another challenge can be that demographic information may not be collected in a detailed fashion for a particular metric. When you go to change metric here to be brought to the full list of measures, you can see the metrics for which we are generally able to provide demographic data, and also those for which demographic data are not available. So beyond the maps and snapshot that we toured today, the metric background page provides access to all metric one-pagers, which are concise summaries that explain more about why and specifically how we measure each of the metrics. These can be especially useful in helping make the case for a particular issue. Also, and importantly, all of the site data is available for download for free. That feature is accessible right from the main menu. You can download data files by state or for all districts, and we provide extensive technical documentation about our calculations and our methods. All right. So that concludes our brief demo of the site itself. Truly a ton to dig into here. Before we move on to the panel discussion, we wanted just to share a couple of practical examples that are grounded in our team's own analyses of how a congressional staff member or an advocate might use the dashboard. First, in looking across the US, we found variation in broadband access across districts. So perhaps you're working for a representative or a senator for a state, let's say Indiana, on leveraging federal infrastructure funding to improve broadband access for your constituents. By exploring the dashboard data, you uncover that while broadband connection rates in congressional districts across the country range from 41% in Southern Texas to about 91% in Virginia's 11th, your state, Indiana, averages of 66%, and that leaves room for improvement. So on closer inspection, you take a look and notice that 2 congressional districts in your state have particularly limited broadband access. So having harvested this information, you share it together with an actual map image from the site for additional visual punch to make the case for targeting resources and programs to those specific districts so as to have the greatest impact in getting your state's residents connected. Another observation we had on reviewing the data nationally pertained to racial and ethnic disparities and low birth weight across districts. So this time, let's say you're a research and advocacy organization preparing a policy brief on improving maternal health and birth outcomes to share with your senators and representatives. Reducing rates of low birth weight is one of your core goals. So you download the site's data, including the demographic data, to analyze states with higher burdens of low birth weight. And your team notes racial and ethnic disparities in low birth weight across many districts, with particularly stark disparities in Alabama, Florida, Louisiana, North and South Carolina. In fact, over 3/4 of the districts in these 5 states, in over 3/4 of them, Black newborns are roughly twice as likely to be underweight at birth than white newborns, with other racial and ethnic groups falling somewhere in between, as we see here in South Carolina's 2nd district. So armed with this information, you decide to direct your national policy brief to policymakers in these states and to partner with local and state-based maternal health programs and initiatives with the goal of reducing rates of low birth weight across these districts. So really, these are examples really just to offer a preview of the rich data here and of its potential. We really can't wait to hear how you will put the data to use to work towards better health for districts across the nation. And indeed, on that note, we actually have another poll question for the audience, which is about that, about how you might use the dashboard. So we're going to give you another moment to respond to this. You should see that showing up now. How do you think you might use the dashboard? So please select the best answer for yourself. And we'll give it about 5 more seconds. Okay, let's see what we got. Again, really a wonderful diversity of responses here, from sharing it directly with elected officials, informing policy decisions, all of the choices that you just reviewed for yourselves, and all of it really applied in your areas of work. So really terrific to see those responses there. That is exactly the intention, is really for the resource to fuel the efforts across multiple sectors and multiple audiences. So we're now going to get to shift gears and turn to 2 national policy experts who are going to help us delve deeper into moving from data to action. And I'm just really very excited now to welcome Andrew Hu and Carolyn Mullen. Andrew Hu serves as Director for BPC Action, and in this role manages BPC's healthcare advocacy portfolio and serves as liaison between BPC and Congress. Andrew has over 15 years of public policy and legislative experience, including in healthcare reform, evidence-based medicine, and patient-centered outcomes research. And Carolyn Mullen is the Senior Vice President of Government Affairs and Public Relations at the Association of State and Territorial Health Officials, ASTHO. In this role, she leads federal government relations, communications, public relations, and state health policy teams. Carolyn has over 20 years of experience as a former Senate legislative aide and as public health advocate. So welcome, Andrew and Carolyn. Thanks so much for being with us today. And I'm going to just dive in and start off our conversation by asking you, Andrew. Data is an important aspect of policymaking, and generally, data is an important aspect of policymaking and advocacy. How are data used in policy decision-making from your perspective and in your experience, and how might something like the Congressional District Health Dashboard help in that?
Sure, and Mark, thank you for the invitation, and glad to be joining you all today. Good afternoon, everybody. This is it's a really good question, and I think you put it perfectly earlier in the opening comments. Data might not be the sole piece that could all of a sudden inform a policy decision, but it provides key context. It informs a lot of the decisions that folks have to make. So having a good evidence base just as a starting point is critical to policymaking and advocacy. So, kudos to the team for building this, and I can see it having broad-based impacts both on the Hill and off as we move towards a number of policy decisions that folks have to make over the next few years. But I think one of the areas that is critical, first off, is just identifying problems, issues that need to be addressed. I think having a good sense of what the district makeup is looking like, both geographic, demographics, challenges, is key. As a former congressional staffer, the most important part is knowing your boss's district or your state, right? Having a good sense of what this constituency makeup is, what the needs are, where their challenges. That's a good baseline, right? From there, you can do a number of things, right? Better directing constituent services is one, right? For one, if we know, hey, we've got a higher rate of opioid addiction and deaths in my district or state, maybe it's one of those things where we can, one, figure out what federal policies we can do to kind of address that, but at the same time, maybe help my constituents at home figure out what available services are that they can access. Yeah. So that's critical. Another area that I would call out is it just provides a lot of context to the policy making that we have to make and decisions that we have to make, both on and off the Hill as advocates or staffers. And then I think over time, and I know this is a goal of the dashboard, as you guys add more evidence and add more data and track it over time, it helps with evaluation. And one of the things that we obviously want to make sure that we pay attention to here in Congress and is how are programs working? We can identify the problem, we can throw a lot of money at it, or we can come up with policy solutions, but at the end of the day, we want to make sure things are working and heading in the right direction. So having robust data tracked over time is critical to that, and can inform policies around evaluation, further development of programs if we need to, tweaking things as necessary. So all that needs good data, and kudos to the team again for building this. And I think hopefully from here, informed decision making is always the goal. Obviously, ideally it's always based on good data, but we know there's a number of factors. But at the end of the day, having good data as a base is critical.
I could add on to that. I also think it spurs intellectual curiosity, right? So you're a congressional staffer, you're looking at this data. There could be things that are working really well in your community. You could say, wow, why is this working so well? And how can we share that with other members of our state, our senators, to really share some of those best practices. So I think sometimes we have a tendency to hone in on where are the problems and how do we solve them, but also where are some bright lights that we should shine upon and what's working well across the country. And it may allow some unique partnerships on the Hill and unique partnerships amongst advocates as well.
Thank you both. And let me ask you, Carolyn, what's an example of how you might use these data in your own work? Sort of how they might work into an issue that your organization, let's say, is actively working on that these data might help inform.
Thanks so much. And thanks again for the opportunity to be part of this panel. Data is definitely a cornerstone of how ASTO approaches our advocacy. And we lead with data, but then we back it up with stories or specific information about what's happening to personalize it so that there are faces behind each one of these numbers. And it's really important that Congress connects to that as well. So an example is, I could drill down a little bit deeper on opioid overdose deaths, for example. We know this is a bipartisan problem that Congress is trying to solve. So I could really drill down on that, say, this is what's happening in your district, Congressman Smith. Here is what we've done to date in public health to try to solve this, but here's where we need to be going. And it's sort of like, did you know about the rate of overdose death in your community? And look at your neighboring district. They actually have a less of a death rate. So are there things that are working well over there that we can bring to your district from a public health, prevention lens? So that's how I think that we are going to be using data like this in our advocacy. I really just think it helps us be more personalized and targeted in our approach with members of Congress and really help tell that story using evidence-based data behind it.
Thank you so much. And sort of building on that, Carolyn, maybe, and then Andrew, love to know if you other thoughts. As you think about some of the main health-related areas of focus that you see Congress pursuing in the year ahead, what comes top of mind?
Maternal morbidity and mortality is a topic that is very important to all members of Congress in addressing prematurity and low birth weight, in reducing infant mortality. Addressing the opioid crisis are sort of the top three things that I view as priorities in this upcoming Congress. But Andrew, certainly would love to hear your thoughts.
Yeah, no, those are areas that we're hearing as priorities as well. I think there's good progress made last year and in the last congressional session on addressing mental health. I think that'll continue to be a focus, a bipartisan focus in this Congress that this information this data can help inform. Another area that will flag, since I know you guys have some good tracking data on this, is the Farm Bill is up for reauthorization, and a major portion of that is related to SNAP and the nutrition and dietary needs of the country. So I think having this information to kind of support that argument would be critical. Yeah, opioids is going to be a big topic of discussion this year, and I know, Congress is already kicking off some discussions and hearings on what to do related to fentanyl. So lots of activity. I think the conventional wisdom may be that there might not be as much activity given divided government, but I think given the health challenges that we face and the issues that Congress that members want to deal with, I think there's having good evidence is ripe for informing this policy discussion this year.
Yeah, most definitely. Yeah, and one of the things on the evidence side that we try to get at in the dashboard are obviously there's a focus on differences across geographies, across congressional districts, but also we've tried to complement that with looking at differences within congressional districts, also by race, ethnicity, and by sex. So how does making visible some of these differences between groups influence the nature or change the nature of the policy dialogue and sort of action-oriented focus? I'll ask you, Carolyn, should have given your name at the beginning, but welcome your thoughts initially on that.
Sure. It really allows for a more concrete conversation as opposed to talking about generalities, and really ensuring that we are targeting programs and policies towards communities that would benefit most from them. And I really am excited that hopefully this data continues year over year so we can monitor progress and trends. That will be critical to Congress. Let's say they make a new investment in X, they're going to want to see the results of that play out over time. So monitoring that over, but it really helps ensuring that we are reaching the populations that need these interventions and assistance the most. So I'm so excited that it is broken down in that way, because it just allows us to have just better advocates, be better at our work, and also allows Congress to not have blinders on when they are working on legislative priorities.
And just to add on, I think that's exactly right. And some of the conversations that I've had recently, from a lot of new members, who are coming into Congress. One, it's just helpful to have this data just so they have a better sense, again, of their constituency makeup. But from some conversations I've had with staff, they're obviously looking, they have a good sense of what's in their district, but being able to kind of easily search, amongst other districts and seeing if there's matching issues that their constituents need, helps build partnerships. And identify other offices or other issues that these offices can work on. So being able to easily access that, I think, can be really helpful.
Super helpful. Let me ask you a related question, which is really just about sort of taking a step back and thinking of creative approaches to using data to help influence change. Andrew, let me put this one to you. Really, as you've over the years, are there ways that you have seen or approaches that you've seen that are particularly effective, or even instances, examples, where data has been applied to influence policy direction, like perhaps a story about how you or fellow advocates have used data to advance specific goals?
Yeah, and I'll take a example. I'll take off my BBC hat and put on my prior job. I used to run public policy for Patient-Centered Outcomes Research Institute, so a funder of research. But one of the things that our goal was at least my goal was for the organization was to advocate Congress to try to get some more funding for the program. And having good data, not just of what our research can do, but its impact it can have and why it's relevant to a member's constituency or their need, I think that was something that was not necessarily a challenge, but something that we had to work through, right? We wanted to tailor our messages to each offices that we go to. And I think that's where having tools like this can help inform the narrative that we're trying to make. And I think Carolyn made this point earlier, right? The data bolsters the story that you're trying to tell. So for me, it was, I wish I had this tool before, right? It would have been helpful to kind of go in and say to X member saying, you have this type of demographic, or you have this issue, health issues in your district. By the way, we have research funding that's trying to address this. Why it's relevant. It's meant to connect the dots for folks. So I could see again, going back to several years ago, I wish I had this type of information readily available. I wish it made our lives a lot easier as advocates.
Thank you. Yeah, I mean, connecting the dots is basically exactly what this resource is chiefly aimed at doing, in just the way that you described. This is a great example. Carolyn, anything you want to add on that one?
I can add a good story and then what not to do story.
Okay, great.
So really good. I used to work at March of Dimes, and one of our priorities was getting a preterm birth prevention authorization bill through Congress. And I always led with data. I would say, did you know 1 out of X children are born preterm? It costs society X number of dollars. And so I had my whole hook, and then staff would be like, I had no idea. And then I was saying, this is what your boss can do to solve it. So that is one of the ways that we've used that I've used data effectively, but it's really short, tight, and it draws somebody into the conversation. You could see staff naturally lean in, like, I want to learn more about, how to solve this terrible problem. I would say a way not to use data, and this happened to me when I was a congressional staffer, is to bring in a PowerPoint presentation and present slides to me. I mean, you're probably the 8th meeting I've had all day. I'm exhausted, and it's like, what do I do with all this information and all this data? So you want to make sure there's an ask there. It's crystal clear to staff what they can do to solve it, and that you promise to follow up after the meeting or after the bill is signed into law and say, these were the results of your boss's work. And this is how you made a difference. They love to hear that, sort of the positive of the results. But please, whatever you do not just go into an office and just talk about data, because you probably won't get invited back into that office again.
It's great advice, and a word for the wise. And staying with you for a moment, you've honed your skills clearly and helped to really, actually, with one of the largest increases, or maybe the largest increase in public health funding in over a decade, to see that through. Can you tell us a little bit about that, and about the sort of types of data that you reference in those advocacy efforts? Also, what you wish you had?
Great. Thanks so much for that question. It was really during the COVID-19 global pandemic and the opioid crisis a couple of years ago, but I can talk really specifically about COVID-19. So we knew that there was a public health workforce shortfall, and we knew that we're going to need to bolster that up with contact tracers during the COVID-19 pandemic. So what we did at the time was took a Johns Hopkins report that did an analysis of what the deficit was. We worked with our colleagues and partners with NACHO and the public health labs and EPIs, and we put together an Excel spreadsheet, and we said, here's where the gap is. Here's the average salary for these people. And we did some math, some not like perfect math, but we did some math, calculated, and then we came up with a number of about 7.6 billion is what we thought Congress would need to provide. And then we provided categories like, this is where the 7.6 billion could go. And we chopped that up on the Hill. And a year later, we ended up getting, for the first time ever, about $7.6 billion for public health workforce. So using the data, doing some math, working with partners though, and then coming up with principles or categories for where that funding is needed is how we targeted that. For the opioid crisis, we knew there were a lot of dollars going into treatment, but there weren't a lot of dollars going into prevention, primary prevention, moving more upstream. So we created a proposal. We did formula runs in our proposal using data, saying how much money would go out to the states, what the states would need and use it for. So we were able to get about $350 million in the appropriations bill a couple years ago for CDC for that effort. So you got to take the data and then map it out, do some formula runs, and provide really specific information to Congress, which is a lot of behind the scenes work that people don't know that happens. You sort of see the public documents, but yeah, taking data, using it with your partners is really key here too. And I see there being a utility of the data here, being like intellectually curious, looking at the numbers, understanding what's happening, mapping out a plan and sharing it with that Hill. That could be really good use for advocates.
Thank you so much, and congratulations and thanks for the success as well. Really profoundly important. Just one follow-up question to Andrew, and then we're going to turn to the audience for some additional Q&A. Let me just ask you, Andrew, just really with your background in health policy advocacy, about which metrics or features of the dashboard you think are going to be most useful to congressional staff and advocates. Just a sort of brief answer.
Yeah, I think we touched on, Carolyn touched on it a lot earlier. And again, having the data points is a great baseline, but it feeds the narrative, right? I think having the metrics and features alone, it's very soothing. I 100% support. It's not enough, right? But it is a critical component towards just policy development, policy advocacy. So, looking at, I've spent a little bit of time yesterday kind of going through the dashboard and just tinkering around. Yeah, it's full of information that can just bolster one piece of the story that you want to tell.
Yeah.
Whether it's trying to connect the dots with a healthcare staffer to say, hey, maybe your boss should also focus on housing issues because it is connected here, right? And I feel like that's sometimes a tough task for staffers to do because they have their one issue. There's hundreds of meetings and 100 folks trying to get their attention. Advocates, can take different pieces of the metrics, all the metrics that you track in the dashboard, help connect the dots for these staffers, and maybe come up with an idea that they hadn't thought about because they're only focused on healthcare. They didn't think about housing impacts or they didn't think about other determinants. So having the broad range, of data that you have across issues, it's not just disease specific. I think is critical for advocates, and I think as Carolyn mentioned again, curious staffers are always going to be interested in areas where they can do more and try to solve problems for their constituencies. So you guys have a number of metrics and measures that you guys are already doing. I see some conversation in the chat about additional ones, so you guys have to work out for adding data. But what I would 100% echo what Carolyn mentioned. The data is the starting point. Definitely help build that narrative around them.
Thank you. Really rich responses from. Thanks much to you both, and we're going to continue that and turn now to a couple of the questions. And you'll see one theme I just want to stress is that sort of really to the point that you just made, Andrew. The dashboard will be, we see it as a sort of dynamic process. We'll be bringing improvements to it over the next 3 to 6 months. We really wanted to get it launched towards the beginning of the 118th Congress, and your ideas and responses are going to help shape that process. So we're very excited about that. There have been a number of questions. Maybe I'll take this sort of first one, really just about how the data are going to be updated over time, and how we might deal with changing congressional districts and longitudinal data and so forth. So really just to address that, we are committed to updating the data that are on the Congressional District Health Dashboard in step with the refreshing of the underlying data sources from which the data are drawn. So if a measure is drawn from CDC data or from the National Vital Statistics System, we will update it on the dashboard once it has been updated by, let's say, in that case, the CDC or by NVSS. And we will do that most often, the frequency, the most common frequency by which some of those underlying data sets are refreshed is annually. And so certainly annually for measures that are updated annually, we plan to refresh the data on the dashboard. And that leads, it's related to another question, which is to looking at changes over time on the dashboard. And you have to understand that we're beginning with a kind of blank slate with the most recent data because the 118th congressional districts have been newly drawn, as you all understand well. And so we can't give you data on what the data looked like in those districts 10 years ago because those districts had different shapes. But these shapes for the 118th Congress, we expect to continue forward for a good number of years and not perhaps to be formally redrawn for the most part, even until the next census in 10 years. So we do expect that over the next 10 years, we will be seeing updates and beginning to see trends in the data that the dashboard includes. And we're absolutely anticipating to have a section on trends in the data as they're updated year on year. Great. A question for Girther. Really about whether you think there may be future opportunities to add policy data to the maps. It sort of ties into what is working well, perhaps in the state and district level, since state policies vary so greatly, whether insurance coverage, paid leave. Do you see an opportunity to work policy in some fashion?
Yeah, I think it's a very natural reaction for folks to see these data and then ask, well, what's causing the differences across districts or even within district? And I think currently, as folks are probably seeing in the database, there are no data on policy strategies, whether a policy is in place in a particular district or not. I think there would be both some technical and strategic challenges in overlaying these type of data with policy data, but it's definitely something worth exploring. And as some folks on the call know, we do support a number of research teams across the country that do just that track how policies are adopted across the country, particularly at the state level, but also at the local level. So I think there might be some interesting opportunities for partnership.
Thank you. Here's a question for Carolyn or Andrew. How can healthcare organizations, or how might healthcare organizations use these data to plan out areas around community outreach efforts?
Happy to jump in, and Carolyn, definitely, I think you're probably much more connected to community outreach than I am at the moment. But I like I said, like we said earlier, I think having access to this identifies where there are needs and challenges, right? So one, I'll do this from, I think I mentioned as from a former staffing perspective. I definitely had worked with my constituent district offices and state offices to kind of identify, how do I direct folks to the right services? So having the data available to at least better understand where there's challenges can at least prompt me to maybe, how do I target community groups to and build coalitions or work with stakeholders to say, all right, we have this challenge here. Let's find ways to address this. Or as Carolyn mentioned, we're doing really well here. How do we promote it? So for community groups, I would kind of use this as an informational, like, kind of marker of just your status, the status of the district and the status of the constituency, and then kind of better target, what do you still need to do, or what can we promote, and kind of go from there. But Carolyn, you probably have a lot more on the ground experience on this than I do.
No, I'm happy to chime in. And I wanted to go back to one of the data points that Mark was showing earlier. So he was showing Texas uninsured rates, and then high in the Hispanic population. So in that congressional district, for example, I could see taking those data and saying, okay, how do we reach what's happening? So that being curious, what's happening here? And B, is there something where we need to be reaching out to these populations and saying, do you know you could stay on your parents' insurance until you're 26 years old? You may not know that. Or is it a Medicaid expansion state, and are people dropping out? Is there what's the reason behind the uninsured rate? And is there a way to really specifically target and then meet people in the community where they are? So is there a local place where everybody's meeting, whether it's a church group, or whether it's a library, or whether it's in schools? Can there be some targeted outreach to help increase the insurance rate in that specific district? So that's why I think is like, you take the data, you look at the demographics, you say, where are their gaps, where are their programs, and how do we meet people in the community where they are to help improve the health overall of the population. So I think it could be like really targeted, and just, you have to like really dig in deep to it. You just can't take a data point and take it at for what it is. You got to understand what the reason behind it.
Thank you. Great, rich answers here. Let me ask a question that for Girther, which is a couple people have asked in different ways, which is that public health is inherently political, and we know that there is a certain amount of polarization now. How might this work, or is there a risk for this work potentially to negatively influence the already polarized political scene? And how do you frame this in terms of the climate currently?
Yeah, I think the challenging thing about our current climate is that just about anything can be politicized, even data. So that's the environment that we're operating in. But I think both Andrew and Carolyn offered a number of great suggestions about how to have conversations, whether they're about health, whether they're about social policy, whether they're about a particular issue in a community, how to have them in ways that engage people from across the ideological spectrum. And I think what I've found in my own conversations with community members and policy leaders is starting from a place of values. What are the things that are important to you? What are the types of changes you want to see for your community? And what type of future do you want for your children? I think if you can start from a place of values, combine it with good data like those that are available in this database, and then connect to strategies that have strong evidence, that is a way to have productive conversations despite the challenges of our current climate.
Thank you for that wise reflection, honestly. And yeah.
And it looks like Carolyn wanted to maybe add on this.
Great. And we're almost at time. Yeah. So
yeah, I wanted to add on that because really at the end of the day, we're all people and we all have more alike than we do in our differences. And really taking that time and meeting with members of Congress behind closed doors and having those one-on-one conversations and understanding, they may have a person in their life who had cancer or who had X, Y, and Z happen to them, and really personalizing those stories. I've been able over my career to really make good strides across both aisles, Democrats and Republicans. And so just remembering that sometimes what members of Congress are saying publicly, it doesn't get to the heart of who they are personally. And so that's why taking the time, really understanding who they are as people and seeing how you can connect with them on an individual level is so important. So I think that there's really a lot of promise here. It takes more time to do that. But now that the Hill's open and we're back in person, I'm excited to work across both sides of the aisle this upcoming year.
Thank you so much for that, and I think it's just the right note, actually, on which to move forward. With those words, I want to turn back to a closing slide. I want to just say one last thing, which is that there were a lot of questions about new metrics, other metrics. Why might we include this or that? We're open to thinking about really all possibilities. The challenge is always finding a data set that actually is rich and rigorous enough to work with on whatever the metric might be. But thank you for your suggestions, and we will be reaching out and absorbing them and tackling them over the next year. I really want to bring our session to a close then, to thank very much our partners, our incredible team here at NYU Grossman, working on the dashboard and the City Health dashboard as well. Forum One, our web developer, Burness Communications, our communications partner, Dr. Subbu Subramanian, methods research expert and colleague, and our bridging partners, the Center on Budget and Policy Priorities and the Bipartisan Policy Center, of course. And to our panelists today, Carolyn Mullen and Andrew Hu, and of course, to my colleague, Girther Malia. So really, strongest thanks. We look forward to hearing from you about the resource, please stay in touch. Subscribe to our newsletter and bulletins and social media. And thank you again. Here's to getting good use out of the site, and see you there.